Good morning, everybody. Thanks for coming to the May Survivorship Lecture Series. Today, we are featuring Anna Titcomb, who's been a registered dietitian at the University of Illinois Health and Hospital System for 8 years, most of her career. She sees patients at the OCC where she provides individualized medical nutritional therapy, which includes treating diabetes, weight management, medical sports nutrition, bariatric nutrition, GI and eating disorders, sports, bariatric, and enteral nutrition. This morning, though, she will speak to us about the benefits of a whole foods, plant-based diet for cancer survivors. So I believe you should have access to share your screen.
Yeah, I think so. Yeah, Dr. Mintz, thanks for having me with you today. I'm excited. I'm excited to be here and to share some knowledge. And like Dr. Mantz said, I work in the Nutrition and Wellness Center. So I'm in the OCC, it's 1801 West Taylor. So I work in general outpatient. So the majority of people that I see referred from oncology in the cancer departments, mostly are referred for weight loss. And so I see many cancer survivors. And for the most part, at this point, what they're dealing with or struggling with is weight management or chronic lifestyle diseases. So hypertension or prediabetes, high cholesterol. So they beat cancer, but now we're addressing these other aspects of their health too. But of course, one of the things we're always worried about, right, is cancer reoccurrence, right, or preventing that cancer from coming back and doing everything we can to do that. So let me get into, oops. But yeah, so today we're talking about a whole foods plant-based diet, particularly for cancer survivors. And this comes up too, of course, with like cancer prevention as well. So yeah, as Dr. Mann said, yeah, my name is Anna. I'm a registered dietitian. My email is down below. I'm going to link it at the end as well. So if you do have any questions, want to chat, anything like that, please reach out. So we're going to start off by first defining what does this mean. So in the last probably like 5 or so years, I think like plant-based diet has become pretty trendy and pretty popular. So the word is getting thrown around a lot more. So, but we're in particular talking about a whole foods plant-based diet, which means that for the most part, people eating in this way are eating minimally processed plant foods. So we're talking about whole grains,
I do, and I'm helping Katie with some babies.
Okay.
Yeah, thank you, though.
Fruits, vegetables, nuts.
Thanks for sending that link to the presentation.
Megan, can you?
For Anna.
And that this is a way of eating that is excluding animal products for health benefits. So people are not eating meat, seafood, any poultry, fish, eggs, dairy. So because the motivation behind choosing the style of eating is health, some people may still eat some animal products, right? They may say, hey, I eat this way mostly at home. On my birthday, I'm going to go out and eat a steak. I'm on vacation, so I'm going to eat some seafood, and they'll have some flexibility around that. So this style of eating has really been studied quite a bit, and it's been very effective in preventing and reversing a lot of the chronic lifestyle diseases. So hypertension, prediabetes, high cholesterol, heart disease. But one of the things I'll always, when patients start wanting to talk about a plant-based diet, especially for their health, we always talk about kind of this like health washing, right? We have a box of cookies right here. It says plant-based right on the front. It's got a leaf on it. It's written in kind of like feel good font. At the end of the day, these are chocolate chip cookies. So they're not a health food. They're a treat, they're a fun food, but they still have sugar in them. They're still, a more refined. It doesn't mean that we shouldn't eat them, but we should be realistic. Just because something is plant-based on it does not mean that it's automatically a health promoting food. And I usually make this again very clear from people that veganism is not the same as a whole foods plant-based diet. So veganism is an ethical or moral stance against the exploitation or commodification of animals. So as you can see on the side, we have plenty of, you guys probably can't see because I'm covering it. We have plenty of delicious vegan foods. We have Oreos, we have sweet chili Doritos, we have Taco Bell, we have KFC rolled out a Beyond Chicken vegan nugget. Again, these are not health promoting foods, but they are in fact vegan. They don't contain animal products in it. So if people are vegans, they are usually doing this for an ethical or moral reason. This typically extends past dietary choices. So people who are vegans typically do not wear things like leather, silk, or wool. They don't go to zoos. Many people do animal rights activism. Veganism is not a health diet. So, and the next question that usually comes up for people is, right, are these diets healthful? Is this an appropriate thing for people to eat? And the Academy of Nutrition and Dietetics, did release a position statement that said, adequately planned vegetarian and vegan diets are healthful, they're nutritionally adequate, they are appropriate for all stages of life. So this includes pregnancy, lactation, older people, adolescents, athletes, and that they are, of course, much more environmentally sustainable. Animal products take a very high toll on environmental resources for their production. So yeah, why would people eat this way? So typically this lowers, when people are doing this whole foods plant-based style of eating, typically it lowers their blood glucose, their LDL cholesterol, decreases risk of cancers. The ones that have been studied the most have been colon, breast, and prostate cancers, decreases risk of heart disease, helps with weight loss by increasing fullness and satiety. A whole foods plant-based diet is typically it's not very calorically dense. So people get to eat, right, these big, beautiful, we see this beautiful chickpea platter here. That's a lot of food. It's a lot of fiber, but it's not that many calories. So people are typically getting really nice fullness and satiety while still getting to eat a good amount of volume of foods. So, and this, of course, these are all lifestyle risk factors that are also associated with cancer reoccurrence. Whole foods plant-based diets are high in fiber, antioxidants, vitamins, minerals, polyphenols. They are low in saturated fat and cholesterol and sodium for the most part. So, and we know that a plant-based diet is very cancer protective. So this was a very large study done, as I'm sure many of you are familiar with this, right? The Diet, Nutrition, Physical Activity, and Cancer study that was done by the WCRF and the AICR. They looked at 51 million people, and this was an observational study that showed that there was strong evidence for increased risk of cancer for people who were eating more red meat, processed meat, dairy, and people who were obese. So looking at these observations, they came up with 10 recommendations. These are the ones that are a little bit more pertinent for us today. So maintaining a healthy weight, and they noticed that people that were so if we have a normal range of BMI, it's 18.5 to 24.9, people actually on the lower end of that, so maybe a BMI of 21, 20, actually were at decreased risk for developing cancer, even within that healthy BMI range. So we know that that people need to get enough exercise in, that people should increase their intake of whole grains, vegetables, fruits, beans to decrease risk for developing cancer. Eating at least 30 grams of fiber a day from food sources. This is in line with the recommendations of the Academy of Nutrition and Dietetics. And then limiting red and processed meat to 12 to 18 ounces per week. This is not a lot of meat. So if we think that the palm of your hand is usually around 3 to 4 ounces of meat, so that if you do 12 ounces, right, that's, maybe 3 or 4 palms worth of red meat a week. This is not a lot, especially if we look at people, oftentimes our patients, right, who are eating a very standard American diet, right? They're having bacon and sausage at breakfast. They're going out to eat and having a sandwich with ham or roast beef on it. They are coming home and having steak tacos. So oftentimes we're looking at our patient population who is consuming meat, dairy, eggs at almost every meal. So another recommendation that they made, and this is a question that I'm sure all of you get often, as do we as dietitians, right? What should I supplement with? And so this study was really promoting meeting micronutrient needs, so the vitamins and minerals through food, not supplementation. And the last conclusion that they made too, that because we know that this way of eating is cancer protective, that cancer survivors should follow these same guidelines to reduce the risk of a cancer relapse. So this was a follow-up study done. I'm gonna see. This. So, oops. So this was a follow-up study done to see the adherence of people to these recommendations. They looked at 2 Swedish cohorts, a fair amount of people, and And the range of potential scores someone could get was like 0 to 7 or 8. So they had 2 different scales. So each 1 point increment in adherence to these recommendations was associated with a 3 to 4% lower risk of cancer. So this is significant, right? If we had a drug that said, yeah, it would lower your risk of cancer by 4%, that would be a pretty good outcome. So we can see that just dietary changes for like cancer prevention is strong. Unfortunately, participants were not very successful at meeting these recommendations. So 98% of participants did not meet these recommendations for red or processed meats. 51% did not meet the healthy body weight recommendations. 54% did not meet exercise. 90% did not meet recommendations to increase these whole grains, vegetables, fruits, and beans. And 92% did not meet recommendations to limit the fast food and processed foods, high in fat starches, simple starches, and sugars. So we can see from this study that there's a lot of room for improvement, and that there's a lot of potential, right, for nutrition counseling and helping people make these lifestyle and behavior changes, because it is hard to make these changes. It's not as simple as telling people that they should do something. It oftentimes means having ongoing support and accountability when people are trying to make these lifestyle changes. Unfortunately, there's not a lot of research on dietary changes for cancer relapse and cancer survivors, unfortunately. This was a nice review here as well. So again, it was looking predominantly at colorectal cancer, breast cancer, and prostate cancer. So they did see that, and a lot of this is kind of hard because a lot of it is kind of observational work as well. So, but they found some correlations or some observations that do promote more of this plant-based style of eating. So a higher nut intake was consistent related to better survival. High fiber after diagnosis was related to a better prognosis for colorectal cancer. And then this is one that comes up too. I'm sure you all have heard this a million times. I have as well, right? Concerns about eating soy from our breast cancer survivors or women with breast cancer. So, but there's some evidence this, supports that like a moderate soy consumption actually has a favorable impact, and that there's no evidence that high soy consumption is associated with adverse prognostic outcomes in breast cancer survivors. So women with breast cancer should feel free to feel comfortable drinking some soy milk or eating some tofu or edamame, or some tempeh. That those are foods that are fine to consume in moderation for sure. Especially given that oftentimes, like our patient population here is lactose intolerant. So oftentimes one things that I am working with my patients is to get off dairy. One, because if you can't digest it, why are you drinking it? Let's look at different sources of, plant-based options for that. And two, knowing that like sometimes dairy can increase the risk for cancer relapse or cancer, a first diagnosis of cancer too. So working on getting rid of dairy. This is an interesting study. I'm sorry, y'all will have to, I'm getting over a cold too, so please excuse me, I'm like working on a cough drop right now so I can talk to y'all. So this is something that I often see referrals for an NWC for cancer survivors is people working on weight loss. Most of my patients have a BMI in the high 30s, 40s, sometimes 50s. So most people are morbidly obese. So, and oftentimes what I get people wanting to say is, oh, I'm trying to lose weight, I'm trying to cut out carbs and trying to go keto. So this gives me the opportunity to give some nutrition education around that I do not recommend ketogenic diets for weight loss for people. It tends to be very high in saturated fat and animal products, tends to raise people's cholesterol. Again, for cancer survivors, would not recommend it to, again, reduce any risk of cancer, reoccurrence or relapse. So, and this was an interesting study that showed that actually a plant-based low-fat diet was actually more effective for people losing weight. So this was an inpatient study. So participants were given food. They could eat as much as they wanted to. One group was eating this minimally processed plant-based low-fat diet. So this was a high carbohydrate diet. About 75% of their calories were coming from carbs. Only to about 10% were coming from fat. And this was whole food sources of fat. So we're talking about like nuts or seeds, avocados. The other group was doing, again, a minimally processed animal-based ketogenic diet. So the exact opposites in percentage. So 76% of their total calories was coming from fat, 10% was coming from carbs. So the low fat group ate less on their own than the low carb group, about 500 to 700 calories less. So of course this led to weight change. That's a caloric deficit. But the nice thing that we saw too about this low fat diet is that it led to significant body fat loss while preserving lean body mass. That's the fat-free mass. So of course, when we support our clients in weight loss, we don't want them to lose their lean body mass, especially not if they've just been, especially not if they're a cancer survivor. We want to keep on as much muscle mass as possible. So we are promoting continued resistance training, exercise, and also this style of eating, or a style of eating that is going to help them lose body fat versus fat-free mass or muscle mass. So this was an interesting study to see for sure. So the next question is, right, well, what about protein? People are very concerned about protein. Protein needs, first of all, are usually lower than popular belief. A lot of times protein is very overhyped in our society and our culture, that everyone is worried about a protein deficiency. You know, I've been a dietitian for about 10 years, and I can tell you I've never seen a protein deficiency in in any of my patients, at least. So protein needs really depend on like how active someone is, right? So for our patients who are the most part, you know, pretty sedentary, we're looking at like 0.8 to like 1 gram of protein per body weight. And for our obese patients, we're really looking at like an adjusted ideal body weight, or ideally looking at like dosing protein off like lean body mass. So it gets a little tricky when people are at higher body weights too. So we can see that, like, you know, for a 70, if we just look at a 70 kg healthy individual, if they're sedentary, they need about 55 grams of protein. I'd say 55 to 70 grams of protein a day. If they're a recreational athlete, if they work out sometimes, you know, probably 75, 100. If they're an endurance athlete, very, you know, a runner, cyclist, you know, swimmer, we're looking at 85 to 100. And if they're a strength and power athlete, they're a power lifter, competing CrossFit, weightlifter, that kind of thing, we're looking at the highest amount, 85 to 125 grams of protein a day. These are not outrageous numbers. Our patients are not bodybuilders. No one needs to be eating, you know, 1 gram of protein per body weight for the most part. Again, this is going to be very individualized based on person to person. Some other questions that come up around protein in a plant-based diet is there's no need to protein combine at individual meals. This is an old way of thinking that says, right, you need to have complementary foods together, right? Beans and rice together, or like tofu and corn tortillas together, right? You have to combine different types of food. So all plants have all amino acids in them, just some plants have less and some plants have more of different types. So as long as someone is eating a diversity of protein sources, right? If they're eating beans and lentils and tofu and tempeh and seitan, you know, they are getting the amino acids that they need. Our body keeps a free amino acid pool to draw from. So again, amino acid deficiency. I was trying to look up case studies a while ago, and like I found maybe like one. It was like a really weird situation, so it doesn't really exist. I will say the only thing for our patients who are heavy exercises or who are getting back in the gym or weightlifting, leucine is a branch chain amino acid that is important for muscle protein synthesis. So I do prefer that, like, if someone is, you know, working on, you know, heavy strength training or things like that, that they do actually eat soy after a workout, or if they're doing like a pea protein. So either doing like soy milk in their smoothie, or like Ripple, which is a pea milk. So that's something to consider. We can see here that, so first of all foods have protein in them, except for like pure oil or like pure sugar. So we can see here that, like, this is an example of a smoothie. This does not have like a strong source of like protein like we would think of it, but altogether it has 23 grams of protein, right? So we're doing a cup of soy milk, we're doing some fruit that has small amounts of protein in it, some spinach, some hemp seeds that have protein in them too. And then on the other side, we can see more protein dense plant sources. Tempeh, which is a fermented soybean product, it's native to Indonesia. Seitan, which is native to China. It's used a lot in like Buddhist Asian cuisines. It's a form of like mock meat made from the protein in wheat, which is gluten. We have tofu, We have sprouted bread, so grains have protein in them. We have nut butter, soy milk, even corn tortillas, 6 grams. You eat a couple cups of broccoli, that's 5 grams. So protein is really additive during the day for people who are following a plant-based style of eating. So we can also see in the smoothie too, right? At first glance, sometimes the nutrition facts are on the bottom. At first glance, sometimes the people are like, oh my gosh, it's 100 grams of carbs. Again, these are very high fiber, unprocessed carbohydrates. They're going to be absorbed quite slowly into our system and into our bloodstream. And with that, right, you're getting 18 grams of fiber just in the smoothie. So for a lot of people, this is going to be quite filling. And again, that fiber, since it's not a digestible carbohydrate, is going to slow down the rise of our blood glucose to really give us some like nice, good, steady energy during the day for sure. We're getting in plenty of vitamin A, vitamin C. We have over half our calcium that we need. We have magnesium, we have iron, we have copper as well. So we're also getting towards those micronutrient needs as well. These are meat alternatives. So people oftentimes ask about these as well. So obviously we have tofu, black bean burgers, crab cakes, sausages. So, and when people ask me about these, it really depends. Some of them are more processed than others. So like something like a Beyond Burger, Impossible Burger is like pretty highly processed. Something like those field roast, those like hot dogs, they're not super, super processed. So there's like a degree in the level of processing. So there was one study that showed that they did seem to be healthier than meat, despite having kind of similar nutritional profiles, especially if we look at something like Beyond or Impossible. These are products that are meant to mimic ground beef. They have saturated fat in it. It's just coming from coconut oil instead of animal fat. And you can see that the sodium is consistently higher as well. Again, it's not really meant to be a health food. It's meant to mimic ground beef. So, if people want to do these things, I'll say, hey, let's keep it maybe, for special occasions, or if you go out to eat, or if you're going to a barbecue and it's just easier, we can also find some less processed meat alternatives too, if people are preferring to do that as well. And then just running over some nutrients of concern. So again, if we go back to that Academy of Nutrition and Dietetics, right, that position paper, that the key word in this, right, is adequately planned vegetarian and vegan diets, or plant-based diets. This is no different from a standard American diet, right, that people still do need to pay attention to what they're eating to get what they need, even if they're eating an omnivorous diet, because if people are eating a standard American diet, they are not getting the nutrients that they need. So, but these are some particular nutrients of concern for plant-based people. So iron, there's 2 types of iron. There's heme and non-heme. Heme iron is found in animal products. It's much more bioavailable to us as people, so we absorb a greater percentage of it when we eat. Non-heme iron is less bioavailable. However, plant-based eaters tend to have a pretty high iron intake just based off the foods that they're eating. So usually it makes up for it. The people that we're most concerned about iron deficiency, of course, is like women who are menstruating, pregnant women, women who are breastfeeding, athletes, particularly endurance athletes as well. So those are people that a little bit more of kind of like a, hey, let's make sure your iron looks okay right now. Of course, iron is found in legumes, dark leafy vegetables, tahini, cashews, fortified cereals, blackstrap molasses, which can be a great sweetener option for someone like an oatmeal in their morning breakfast. So, and there are multiple ways to improve iron absorption of non-heme. So examples of those would be like adding sources of vitamin C. So a great example of this, right? If someone is having like a Chipotle style bowl, right, and they have some rice and they have some beans, the beans have iron in it, let's saute some like peppers and onions, right? Or let's add some salsa to that to get some vitamin C, right? So we can boost that that absorption a little bit. Cooking in cast iron, especially like acidic foods like tomato, because some of the iron will leach into our foods. And then there are certain compounds in coffee, tea that can block the absorption of iron. Calcium also interferes with the absorption of iron. So we can also say if someone is taking an iron supplement, hey, let's not take this in the morning with your coffee. Let's work on separating this a little bit. Iron supplements have the potential to cause some constipation or GI distress. Usually I'll have people take them at night so they can take that, go right to bed, so they can avoid any nausea, and the liquid forms are better tolerated too. Calcium is also a nutrient of concern. Tofu is actually a great source of calcium because the way that tofu is made like cheese, and so the way that they set the soy milk is actually with a calcium salt most of the time. So calcium is a good source of calcium. Most plant milks are fortified with that as well. So other sources would be soybeans, dark leafy greens, again, molasses, almonds, and some other nuts. B12 is an environmental vitamin. It's not naturally found in animal products. Animals store it in their flesh and their tissue, just like we do as humans. So B12 from like a historic perspective, we would have gotten from like bacteria and like dirt or like dirty food when we were eating. That's doesn't usually happen to us now. So B12 is something that people who are on a predominantly plant-based diet do need to supplement. So there's oral, of course, oral supplements. Some people need injections if they're not absorbing that, or if they have some malabsorption issues. So sometimes people will say, oh, I'm going to get it from my seaweed, or there's some B12 in tempeh. This is not an active B12 compound. It's inactive. We are not going to absorb it. So it's best just to supplement instead of relying on these, food sources. There is B12. It's oftentimes fortified in plant-based stuff, or like nutritional yeast is fortified with it. But, if someone's really I'm like, just take a supplement. The, the potentials for B12 deficiency is like permanent nerve damage, and it's a cheap, easy supplement. So let's just take it and not run the risk. Another nutrient of concern, of course, is vitamin D. This again is another environmental vitamin. We make it in our skin through sunlight. Of course, we live in Chicago. We're oftentimes covered up or inside. Darker skin needs more sun exposure as well. So our patients of color are at higher risk for vitamin D deficiency. And if they are out in the sunlight, they will need longer sun exposure to make the same amount of vitamin D as someone who has less melanin in their skin. So that's something to be aware of. Of course, most people are deficient, so most people should need to supplement. The best way to dose is dependent on lab values. If someone has very low vitamin D levels, oftentimes the physician will want someone to take these kind of mega doses, maybe once a week, to get stores up a little bit quickly. And then, of course, the omega-3s. We can produce omega-3s from ALA. Plant sources are like ground flaxseed, canola oil, hemp seeds, walnuts, and soybeans. I also have people who choose to supplement with like the vegan equivalent of an omega-3 supplement comes from algae, so they'll oftentimes choose to do that. Zinc is another, especially for immunity, another nutrient of concern. So again, this is found in a number of different plant foods, and you can see too that these are just normal foods. So we really encourage people to be flexible and eat a variety of foods, because then they have a better chances of meeting all their nutrient needs. Okay, so this is really another question, right? I'm like, okay, well, so I'm not eating meat anymore. Like, well, what do I eat? These are two examples of how a meal can be structured for a whole foods plant-based style of eating. So this is a plate method. It's very similar to the method exactly the same as the method we would teach to someone who is eating meat. This is kind of a weight loss style of eating as well, but it depends on the person and their nutritional needs. So we have half our plate non-starchy vegetables. So on the left, right, we have some kale sauteed with some peppers. It's like some peppers, some onions. On the right, we have some zucchini looks like grilled zucchini and onions, peppers. And then for our protein for both of these, right, we have black beans. For our carbohydrate, we have sweet potatoes on one, couscous on the other. So again, this is pretty normal food. A plant-based diet really does fit in well too with cultural preferences. Every culture, every type of person in this world eats some sort of plants. So a plant-based diet is also very easy to customize or like contextualize to our patients with different cultural backgrounds or different styles of eating, for sure. And so that, I just made you guys a sample day 2. So this is what it might look like, right? Steel cut oats, cooked in soy milk, put some nut butter, some frozen fruit, some cinnamon on there. For lunch, we could have a tofu wrap with some hummus, a bunch of veggies on it. We could have a side, of sliced cucumber and jicama, put a little lime juice over that, have some fruit on the side too, if you like. Snack, maybe we'll have some edamame, throw it in the microwave, eat it out of the pod. For dinner, an easy beginners plant-based meal is honestly just chili. You just make it with beans instead of meat. So we got a sweet potato black bean chili. We can top it with avocado instead of cheese. We can have some cornbread on the side, and then for dessert, having some fruit. That's a very easy, very simple, again, whole foods plant-based style of eating, what that might look like. Transition tips for patients. So this is not the only style of eating I teach at Nutrition and Wellness. This is a style of eating that I'm very familiar with. This is the style of eating that I do. I don't usually share that with patients, but I share it with all of you so you know where I'm coming from. So this transition can be difficult for people because I'm the same way, right? I grew up eating meat, dairy, eggs, seafood, so this is a big transition for people oftentimes. So the best way to transition oftentimes is just to start slow, right? Try a meatless Monday, do one new recipe. Think about what you normally like to eat. If it's chicken Alfredo, okay, great. Can we look up some new recipes? How about we do chickpeas and pasta? Can we look up a cashew-based Alfredo sauce that you might like to try, right? So let's start thinking about food in that ways. Other ways that people might do is they might swap one animal product at one time. So they'll say, I love eating scrambled eggs for breakfast on the weekend. Okay, can we try a tofu scramble instead? Would you be open to doing that? If people are using eggs and bacon, baking, there's, ways to sub for that too. If people are used to drinking milk in their coffee, can we try switching it to unsweetened oat milk instead? If cheese is a big one for people, and oftentimes it means replacing it with something that still has kind of that fat or that umami sort of savory flavor, So if you're used to eating cheese on a burger, can we do avocado instead? You love cheese on your sandwich? Great. Can we put some hummus or baba ganoush? Can we put a different spread on that so it still tastes good? So what can be helpful for people too is trying some of these dinner ingredient services. So these are like meal prep kits. They will send the ingredients to you. You still have to cook it. But these two services are both plant-based. And it's nice too, because it comes with like pictures, step-by-step instructions. So it can be nice for people who are like, okay, well, I don't even know what tofu looks like when it's done, So that can be super helpful. Same thing with like social media is a great place to look up recipes, get support from other people who have been through the same journey as well. There's a lot of people who have shared their like plant-based health journeys on YouTube in particular. It can be really motivating for people too. And part of this, well, for people is just enjoying the process and the journey, knowing that it's probably not going to change overnight. Some evidence-based nutrition for you all. This is the position paper again for the from the Academy. The Physicians Committee for Responsible Medicine is a plant-based group of physicians. They have wonderful resources for clinicians. Veganhealth.org is a nice reference site written by a vegan dietitian. So he has lots of great resources about like supplementation, vitamins, all this stuff too. Nutritionfacts.org is also run by a plant-based physician. He has a lot of evidence and a lot of studies, so it can be a nice way to look up some things too. And then this last journal article is just a nice overcap of like, why you as a physician or a clinician would recommend a plant-based diet for your patients. What are the benefits of doing that? Lots of recipes for you guys. So this is oftentimes the hardest thing too. And people, they're like, I just don't know what to make. So these are some recipe sites to check out for sure. Vegan Risha, she is Indian and cooks a lot of Indian and Southeast Asian food. I love her recipes. They always turn out really good. Fat-free vegan, despite the name, I know a lot of people are like, oh my God, there's no way that's going to taste good. Her recipes are awesome. You do not miss added fat in it. She uses a lot of flavoring, herbs, spices, seasonings. And then Sweet Potato Soul, I love her recipe. She cooks from like soul food, like Southern American style. Again, really delicious. And then Dora's Table is a Mexican plant-based blog. So I've learned a lot about Mexican cooking from her blog too. And again, her recipes are all super good. So yeah, I think that's it. I would love to hear questions, comments, thoughts.
Well, you've made us all very hungry. And
oh, good.
All these plates of foods and recipes sound absolutely delicious. This is largely what I do with, minor differences. I think that,
Mhm,
yeah, very healthy and just really great. I did take a couple of notes. I had a couple things, and I'm sure there's going to be a lot of discussion.
mhm.
Um, how do you assess with your patients when they come in their nutrient intake and their like customer diet, and where to make little changes? I've been a big proponent of that. Take it slowly,
Yes,
one change at a time, because this is behavior change. It's very
yes,
difficult to get
right.
patients to even entertain some of these ideas.
Yes.
So how do you like assess that when they come in? How do you talk with patients?
Yeah, absolutely. So I've been an outpatient, so I've only ever worked outpatient as a dietitian. So I do a ton of motivational interviewing and always have. So my nutrition counseling is very patient centered. So a lot of the time it's listening to people, right? Saying, hey, where are you at? What are you interested in changing? What do you want to do differently? What would be important, for you to start on doing? Because I find that a lot of people are either one, they're in that very pre-contemplative stage of change, and they're like, I'm not gonna not eat bacon anymore. And you're like, okay, that's fine. Is there something else you maybe want to do differently or something else you want to focus on? Um, or two, maybe they're a little bit further along in that behavior change wheel, but they are feeling just overwhelmed, right? They're looking at all this stuff and they're like, I don't even know where to begin. I have to do this whole overhaul of everything. I can't eat any of my foods anymore. I have to stop drinking soda and blah, 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 whatever. So then for people, it's kind of narrowing it down and saying, okay, well, where would you like to start? What would be the most important thing for you to change? As dietitians, to get a sense of where people are at. We do dietary recalls, talk to people, share with us what you're eating. What did you have to eat yesterday? I ask a lot of my patients to keep food journals, so we can review those together. Of course, stressing that I'm a non-judgmental provider. I don't care. Please just be open and honest with me. There's no judgment for me about what you are or not eating or what you are or not doing. So I think making it a very collaborative space for us to work on this together instead of me saying, why would you do that? Or, oh, that's disgusting. You have to stop eating that immediately, like, which just it's just not effective for change. Yeah.
Yeah, comments, great presentation. This is all important, awesome information for all of us, and we'll be sending out this recording so everyone can listen to this
Yeah.
times. Does anyone else have any other questions? I have tons.
Can I
I
ask
have
you
a question.
Anna?
Yeah.
So kind of in regards to what Dr. Vance was saying, it can be overwhelming for patients to start with all the wonderful things you just shared with us. Are there any of the things you shared with that if a patient is to say, okay, if I start with one thing, like of all the things you told us, is there one thing that can make the biggest impact if it's just one thing to start so the patients can feel success with one like much more important thing?
Yeah, for sure. I often ask patients to start, can we add? Right? Because they come in to see me as a dietitian and they're expecting me to yell at them, be the food police, and take away everything that they like. So oftentimes they'll talk, what can we add? Can you add a piece of fruit to breakfast? Can you add a vegetable to lunch and dinner? Can you add a little bit more water? So when we start adding some of these things in, the effect is that sometimes it pushes out unhealthy things, right? If you're working on drinking 2 liters of water a day, maybe that doesn't leave you a lot of room to drink soda. If you are adding a piece of fruit to breakfast, maybe you're a little bit fuller, right? And that's going to crowd out the snack craving that happens around 10 in the morning before lunch. So oftentimes I'll ask patients to start actually adding, what would you like to add in versus what do you never want to do again?
Thanks. That's so helpful and feels, I think, very positive for patients to start with what can you add instead of what can I take away? Thanks.
Yeah, I usually reinforce too, our patients, usually people are eating fruits and vegetables and they do have fruits and vegetables that they like to eat. So that's always a follow-up question for mine too, is like, hey, what kind of vegetables do you make at home? What do you like to eat? And most of the time people can tell you at least a couple, and you're like, great, awesome. You like to eat broccoli. That's awesome. How do you fix it? Oh, okay, we usually eat with cheese sauce over it. Okay, well, can you use half of what you would usually add on that? oh, you love to eat salad. That's great. Why don't we do a big salad? But can you work on actually getting a measuring spoon and portioning out 1 tablespoon of ranch to put on it too? And I think that can really build some confidence in them to say, yeah, actually, I do like eating vegetables, or yeah, you're right, I love eating fruit. I can add a banana at breakfast. That's no problem for me. And it builds some of that self-efficacy and self-confidence.
Can you bust a myth really quick, Anna?
Yeah.
Frozen versus fresh vegetables and fruit.
Yeah, both are fine. Yep. So yeah, absolutely fine. Again, a lot of our patients, right, are either, some of them are food insecure. We have a lot of financial, difficulties in our patient population too. So of course we have to be sensitive to that. So fresh and frozen are equally fine. Oftentimes, like, frozen can actually be sometimes a little bit healthier because it's picked and frozen right away. It's not traveling this long distance to get to us. It's flash frozen right at the fields where it's picked. And oftentimes, again, it's just much more accessible to our patients. Even for canned fruits and vegetables, if people are doing that, I'll ask that they get the fruit packed in juice, so not heavy syrup or light syrup. If they like to eat canned vegetables, or if that's what they have access to, either getting no sodium or even just rinsing them off to get some sodium off of them too is completely fine.
Cool. Mary, you have a question?
Yeah.
Hey, Anna, going back to talking about supplementation,
Mhm.
what do we need to know about brands of supplements that are on the market as far as being plant-based or any animal products within the supplements?
Yeah, for sure. That's a great question. The big one for people is if they are vegan, if they are doing this, for animal rights, if they are working to totally avoid any animal products in their food, the one to be most cautious about is vitamin D. Most vitamin D is derived from lanolin, which is the oil in sheep's wool. So someone who's vegan is not going to take that supplement. So we will work to get a vegan source of vitamin D, which is usually coming from lichen. Someone who's plant-based for health is usually not concerned about that. So then it's fine for them to, if they don't have an objection to it. The other one would be omega-3s. So if people do not want to consume fish product, then we would do a vegan omega-3 that is coming from an algae source rather than a fish source.
Thanks. And if there was a daily multivitamin, like, somebody wanted to take it a couple times a week as a security,
Yeah.
right? Is there, like, Women's One a day, is that a problem, or a Centrum, or do you know of any brands that would be better than others?
Yeah, I think that I can send you some too, Mary. I want to say the brand I think is called Garden of Life, but they have like a totally vegan, like Women's One a day or a multi too, but I can look into that a little bit further. The deciding factor is probably just like vitamin D, like a regular Centrum vitamin and mineral that doesn't have vitamin D in it is probably already vegan. So
it's interesting that you say that, because some of the tube feedings that have come out that are plant-based are not allowed to be called organic. There was the Nestle Complete one was not allowed to be, one of the ones was not allowed to be called organic, because it had vitamin D from lanolin.
Oh, okay. Yeah,
I think it was the Harvest. I think.
Right.
I'm not sure. Yeah.
Mm-hmm. Yeah, that's interesting. Yep. Yeah, and obviously, and most vegans will make an exception for like medication, right? Like if they were in the hospital and they were on a tube feed, and and it was like the only one they could tolerate was something that was like maybe animal based, then most people would be fine in that situation, because that's a situation where if your health is at risk, then it makes sense.
Agreed.
Yeah.
Anyone else have questions for Anna? Ask all of your questions right now. Yeah, I thought you brought up some really interesting points that I know everyone's really concerned, not everyone, but a lot of people are concerned about the soy thing, right?
Right, for sure.
Phytoestrogens.
Yep.
So it's really interesting that research has not proven a problem with that.
No, yeah. It's interesting because and a lot of that research, I think, is interesting to look at populations that traditionally use soy, right? If we're looking at Asian populations, right, Korean, Chinese, Japanese populations of women who do drink soy milk or do eat tofu or edamame, we don't see an increased amount of breast cancer, in these societies. So there's been some studies too that, really, again, like, we're looking at more unprocessed forms. So, should someone only eat highly processed soy protein isolate all the time, maybe that's not a great idea, but for women who say, yeah, I'm lactose intolerant, I like some soy milk in my smoothie or in my coffee, or I'm eating a tofu stir fry for dinner, in normal amounts, it does not seem to be an issue.
Great. Yeah, and I always forget the vitamin D, that it's less well absorbed in Black individuals, because in our survivorship clinic, I would say the average vitamin D is around 30.
It's really low,
It's
right?
really low. And
Yeah.
I know I'm told, I've seen a couple of practitioners of functional medicine lately, and like, oh no, like what you 50 to
Right.
80. And so that's a tough one to feel like you're getting enough of.
Yes, it can for sure, right? And obviously, even if we're outside in the summer, right, we want to wear sunscreen, so, and that blocks vitamin D production as well, even for people with darker skin. We're obviously concerned about skin cancer as well. So, right. So for a lot of people, yeah, vitamin D supplements just make sense.
Yeah, it's true. There are multiple things that you supplement, but it's interesting that you said the B12 is just supplement. It's always something we're very concerned with cancer survivors too. It's on the standard panel of routine
Yes.
labs for cancer survivors, because, and I learned from Dr. Susan Hong that under 300 you replace, because
Yes.
cancer survivors are more at higher risk. So I know our hospital says it's something like 150 or something is a normal range.
Right.
So, and that's the other thing too, the normal ranges and
Yes. Right.
RDAs, it's like maybe a little different for different people, and change your recommendations on diet or
Yeah.
supplementation.
Yeah, for sure. I think that's been an interesting thing that actually more like functional medicine has been focusing on, right? Like, what's the difference between kind of a normal range, right, versus an optimal range for humans, or where, so right, is someone's vitamin D maybe a 40, but it would actually be better to be a little bit higher, so they're going to feel better, right? Or a B12 should really be above this number, for people really to have kind of more optimal functioning than just right, than just kind of our reference ranges or our standard ranges.
Yeah, there's a lot more now about optimization rather than just replacement, or getting to the bare minimums kind of thing.
Right.
So do you have any comments on an anti-inflammatory diet?
Yeah, that's a question I get a lot from patients, especially cancer survivors, right? People are very concerned, about sugar, right, or refined sugar, things like that. And usually I'll say that like an anti-inflammatory diet is just a healthy diet, right? What are the inflammatory foods? Junk foods, snack foods, fried foods, processed foods, alcohol. Stop drinking alcohol. Those are foods that all promote inflammation in our body. So people do not need to take superfood supplements or powders or pills. If we focus on eating a lot, and then again, when we're talking about plant-based style eating, it's not all or nothing. People can and do still eat some animal products, or they find that blend, or that balance that works for them, to say, an anti-inflammatory diet is one that is colorful, high in fruits and vegetables, high in fiber, high in variety, getting all these different, plant foods. And
yeah, especially for a lot of people who experience a lot of bloating, a lot of lots of things, anti-inflammatory can be really great.
Yeah.
Anyone else have other questions? I can keep asking.
I have a question. I'm not sure if you answer this, so apologies if you did, but I feel like a lot of patients want to become plant-based, like when they get their initial diagnosis, whether they're getting chemotherapy, let's say in the neoadjuvant setting or adjuvant setting, or even setting. So in any of those scenarios, obviously you don't want people to be drastically changing anything as they're about to embark on systemic therapy.
Right.
So what's the recommendation in those situations?
Yeah, for sure. And I usually honestly don't see those patients or don't work with them. So usually then I I don't mean to put anyone on the spot. Brittany can chime in if she wants to, because I see that she's on too. So, you know, from my perspective, it'd be like working with the patient to see, right, what they can tolerate, what they're able to eat. And then, of course, like, you know, those would be my colleagues in oncology too, that are working with people through their treatment to find foods that work for them, you know, and that they are able to tolerate, that we are able to get that nutrition in. Yeah.
Yeah, I think there's room for it. I mean, I'm always like, yeah, let's improve the diet quality of what
Right.
you're eating. Sometimes I'll see people that are like want to change their whole life. They're cutting sugar out, they're drinking the alkaline water, they want to go all organic or all vegan, and they're changing all these things, and then I'm seeing them like lose weight because they're following like a healthier diet plan. But I'm like, okay, but you also don't feel good. You're not eating because you don't feel good. So, you know, if what you have a craving for is like a junk food, I want you to eat what's going to make you feel good and like maintain your muscle mass. So if you do it right, I think there's room for it. But I think that a lot of times our patients just don't feel good enough, and they don't have the financial means or the health literacy to like implement some of these things and like perhaps the correct way to do it. And so you kind of have to meet them where they're at. So I'm never like on board with them when they're like, I'm changing my whole life. And I'm like, let's change one thing.
Yeah.
Right. Let's just stop drinking soda.
Definitely. The access issue is
Yeah.
definitely, and food deserts and environmental barriers is just pronounced in a population like ours for sure. So always something to think about. Do you guys do a lot of like food sensitivity testing as well for patients that have like gut issues that maybe modify their diet?
Yeah, for sure. If a patient is concerned about like food intolerances or allergies, you know, I do always ask them to see GI or to see an allergist. Oftentimes like the food allergy tests that are available kind of like over the counter, what people are doing on their own, are not validated. So they're picking up on antibodies that are present after just eating these foods, right? So if you're eating soy and you're taking one of these food allergy tests, it's going to say soy. It's not that you're intolerant to it, it's just that you just ate some of it. So there are antibodies in your system that the food is picking up on. You know, there's a lot of stuff like that now, and people get really restrictive. And I will always tell my patients this, like, there is no reason for you not to eat a food that you can eat. You know, there's no reason for us to cut things out just because you think it. You know, if you feel like you are having intolerances to some food, first let's go see an allergist, or let's go see GI to actually do some validating testing around that. Or let's start keeping a food journal and start looking at symptoms and intake kind of overlap too, because a lot of the times a lot of the GI symptoms are oftentimes very also connected to like mood, right? You know, anxiety, stress, worry, especially if someone has just gotten a cancer diagnosis, right? This is an extremely stressful time of their life, or they're they're very concerned or worked up, you know, or they've just finished treatment and they're very concerned about their cancer coming back, you know, or preventing a relapse. That oftentimes there's different factors going in there. Yeah.
Yeah, it's so interesting, that whole axis between mental health, gut health,
Yes.
nutrition,
Yes.
and everything. So definitely a complex problem.
Mm-hmm.
Well, if anyone has any other questions, I know some of us have 10 o'clock meetings to get to. Thank you so much, Anna. And Brittany, I have to set up an appointment sometime with one of you to dissect my diet. So again, thank you so much for the talk. The recording will be available. We will get that sent out. I hope everyone has gotten a lot out of this. I think they have. So have a great morning, everyone.
Yeah, thanks so much for having me, Dr. Mance. I appreciate it. If anyone has questions or anything else comes up, please feel free, email me, call me, you know, whatever you need.
Thanks, Anna. Great job.
Yeah, of course. Thanks. Take care.
Bye.